Most people believe that the only way to find out if they have diabetes is through a blood test. But the truth is, your body has been trying to warn you long before that moment ever comes. And what is surprising is this. The very first signs often appear in a place almost everyone ignores every single day: your feet. My name is Dr. Michael Harris. I have spent more than 20 years working with patients, and there is one pattern I see again and again. People walk into my office thinking they are perfectly fine, only to discover that their body has been sending clear warning signals for months, sometimes even years. They simply did not know what they were looking at. That is exactly why I am making this video today. Because I have seen too many people find out too late. Not because they did not care about their health, but because no one ever showed them where to look. Recently, I met a 67-year-old man who had just retired. He lived a healthy lifestyle, stayed active, and felt completely normal. During his visit, before we even talked about lab tests, I asked him a simple question about his feet. He told me they felt slightly numb from time to time, but he assumed it was just part of getting older. But what he did not realize was that his body had already been giving him multiple warning signs. And when we checked his blood sugar, it was clear he had been living with diabetes for quite some time without knowing it. Today I am going to show you exactly what I showed him. 11 warning signs that can appear right on your feet, signs that millions of people experience every day, but rarely recognize. For each one, you will understand what is really happening inside your body, what most people assume instead, and most importantly, what simple steps you can start taking today to protect your health. Because once you know what to look for, you are no longer in the dark, and that knowledge can make all the difference. Let's start with the first sign, and this is one that often gets ignored until it becomes serious. A small cut or blister on your foot that just does not heal. Most people look at something like this and think it is nothing. Maybe it was a tight shoe, maybe you walked too much that day. Normally, small wounds heal on their own, but when your blood sugar stays elevated, your body loses that ability. What is happening inside your body is a circulation problem. The tiny blood vessels in your feet begin to narrow and stiffen. Oxygen and nutrients that are supposed to repair the skin simply cannot reach the wound fast enough. Think of it like trying to water a garden with a hose that is bent in the middle. The water is there, but it is not getting to where it needs to go. So the wound stays open longer than it should. And an open wound is not just a delay, it is an opportunity for infection. Here's what I want you to do. Starting tonight, take a moment to check your feet. Look closely. If you see any cut, blister, or broken skin, clean it and monitor it. If it does not improve within a couple of days, do not wait. Take it seriously. Now the second sign. This one is extremely common, and almost everyone has experienced it at some point. A tingling or numb feeling in your feet. Many people describe it as pins and needles. They say their foot just fell asleep. And yes, that can happen occasionally. But the key question is this: is it happening often, even when there is no clear reason? If the answer is yes, then we need to pay attention. This sensation is often caused by early nerve damage. Excess sugar in your bloodstream begins to slowly damage the outer layer of your nerves. I often explain it like this. Your nerves are like electrical wires. Each wire has a protective coating that allows signals to travel smoothly. When that coating gets damaged, the signals become distorted. And that distortion is exactly what you feel as tingling or numbness. This is one of the earliest warning signs your body gives you. And it is also one of the easiest to ignore. A simple habit can make a real difference here. Try to walk every day, even if it is just for 20 to 30 minutes. Movement helps improve blood flow to your feet and supports nerve health. Now let's talk about the third sign. This is the one many people find the most uncomfortable, especially at night. A burning sensation in your feet when you're trying to rest. Patients often tell me their feet feel hot, almost like they are on fire. Some say it keeps them awake at night. During the day, it may not be as noticeable, but once everything gets quiet, the feeling becomes impossible to ignore. What is happening here is not heat from the outside. It is coming from inside your body. The nerves in your feet have been affected, and they start sending incorrect signals to your brain. Your brain interprets those signals as heat, even though there is nothing physically causing it. Imagine a fire alarm going off in a building that is not actually on fire. The system is misfiring. That is exactly what your nerves are doing. To support your body, there are two simple things you can start doing right away. First, make sure you are drinking enough water throughout the day. Proper hydration helps your body manage excess sugar. Second, add more fiber to your meals. Foods like vegetables, beans, and oats help slow down how quickly sugar enters your bloodstream. These first three signs may seem small, but they are often the earliest signals your body sends, and recognizing them early can make a significant difference. Now, let's move on to the fourth sign. This is one you can actually see with your own eyes, but most people never connect it to blood sugar. A change in the color of the skin around your feet or ankles. Some people notice their skin becoming darker, slightly red, or even developing a faint bluish tone. And almost every time they assume it is something harmless. Maybe sun exposure, maybe just natural skin changes with age. But there is a specific pattern I want you to pay attention to. When circulation becomes compromised, your feet are one of the first places affected. Here is why. Your feet are the farthest point from your heart. Blood has to travel the longest distance to reach them. When blood vessels begin to narrow due to elevated sugar levels, that delivery system slows down. Think of your bloodstream like a delivery service. It carries oxygen and nutrients to every part of your body. But when the roads become narrow and damaged, those deliveries do not arrive on time. And when your skin is not receiving enough oxygen, it starts to change color. That is not just a cosmetic issue. It is a visible signal that your circulation is under stress. A simple habit can help here. Spend a few minutes each morning moving your feet. Rotate your ankles, lift your toes, stretch your calves. Even small movements can improve blood flow. Now, the fifth sign. This one surprises many people because it looks like a simple skin problem. Cracked heels that do not improve no matter what you use. You might think it is just dry skin. And in many cases, that is true. But when the cracking becomes deep, persistent, and does not respond to moisturizers, something else may be happening. This is often linked to damage in what we call autonomic nerves. These are the nerves that control automatic functions in your body, including moisture levels in your skin. When these nerves are affected, your feet lose their ability to stay properly hydrated from within. So even if you apply lotion on the surface, it does not fix the underlying issue. I like to describe it this way. Imagine your skin as a protective wall. When everything is working properly, that wall stays strong and sealed. But when the internal support weakens, cracks begin to form. And those cracks are not just uncomfortable. They can become entry points for bacteria and infection. What you can do is simple. Moisturize your feet every night before bed. Focus on the heels and soles. But avoid applying lotion between your toes. At the same time, make sure you are drinking enough water throughout the day. Hydration from the inside is just as important. Now let's look at the sixth sign. This is one that many people overlook because it does not always cause pain. Skin on your feet becoming unusually thin, shiny or fragile. At first glance, it may even look like your skin is smoother than before. But that smooth, slightly glossy appearance can actually be a warning sign. Over time, when your feet are not receiving enough nutrients and oxygen, the skin begins to lose its strength. It becomes thinner and more delicate. Small pressure or friction that would not normally cause a problem can now lead to injury. This is your body telling you that the tissue is not being properly nourished. Think of it like fabric that has been worn down over time. It may still look intact, but it tears much more easily. The best thing you can do here is focus on improving circulation. Gentle daily movement, even light walking, can help bring more blood flow to your feet. Also, pay closer attention to any changes in your skin. If it bruises or breaks easily, do not ignore it. These signs are visible, which means you have the advantage of being able to catch them early if you know what to look for. Now let's move into the next group of signs. These are often misunderstood, and in many cases people treat them for months without realizing the real cause. The seventh sign is changes in your toenails. Thickened toenails or nails that start to change color. Most people immediately assume this is a fungal infection. And sometimes it is. But when circulation in your feet is reduced and your immune response is weakened by elevated blood sugar, your nails become more vulnerable. They may grow thicker, become yellowish, or look uneven. What is important to understand is this. Your nails rely on a steady supply of nutrients and oxygen, just like your skin. When that supply is compromised, the structure of the nail begins to change. So instead of only treating the surface, it is important to pay attention to the bigger picture. Keep your feet clean, trim your nails carefully, and monitor any changes. If the condition persists or worsens, it is worth having it checked professionally. Now, the eighth sign. This one often shows up at the end of the day. Swelling in your feet or around your ankles. You may notice that your socks leave deep marks in your skin, or your shoes feel tighter than usual by the evening. Many people assume this is simply from standing or sitting too long. And sometimes it is. But when swelling becomes consistent, it may be a sign of something deeper. High blood sugar can affect your kidneys over time. Your kidneys are responsible for regulating fluid balance in your body. When they are not working efficiently, fluid begins to accumulate, especially in your lower extremities. Think of your kidneys as a filtration system. When that system becomes less effective, fluid backs up, and because of gravity, it settles in your feet and ankles. One simple habit can help. When you are resting, try to elevate your feet slightly above the level of your heart. This helps move fluid back toward the center of your body. Also be mindful of how much salt you are consuming. Too much sodium can cause your body to retain even more fluid. Now the ninth sign. This is one that is very often misdiagnosed. Sharp stabbing or electric-like pain in your feet. Some people describe it as a sudden jolt. Others say it feels like a needle or a shock. And many assume it is related to joints, muscles, or old injuries. In reality, this type of pain is often coming from your nerves. When nerves are damaged by prolonged high blood sugar, they do not always become numb. Sometimes they do the opposite. They become overactive and start sending strong signals to your brain, even when there is no real trigger. Imagine a car alarm that keeps going off for no reason. There is no danger, but the system is malfunctioning. That is what is happening inside your body. Pain like this is your nervous system asking for attention, and masking it with temporary solutions does not address the root cause. A helpful daily habit is to gently stretch your feet and ankles each morning before you stand up. At night, a light foot massage can also support circulation and help calm irritated nerves. These signs are your body's way of telling you that deeper systems are being affected. And the earlier you respond, the better your chances of protecting your long-term health. Now we are moving into the final two signs. These are the ones that often tell me the condition has been developing for a longer period of time. The 10th sign is something many people have experienced for years but rarely question. Feet that feel constantly cold. Not just in winter, not just when the weather changes, but cold even in warm conditions. Cold under blankets. Cold when the rest of your body feels perfectly comfortable. Many people simply assume this is normal for them. They say they have always had cold feet, and sometimes that is true. But when it becomes persistent and does not match the environment, it is worth paying attention. What is happening here is related to blood flow. Your blood carries warmth throughout your body. When your blood vessels begin to narrow or stiffen due to long-term elevated blood sugar, that warm blood cannot reach your feet efficiently. Think of your circulatory system like a network of pipes that carry heat through a house. When those pipes become narrower, the heat cannot reach the farthest rooms. No matter how much heat is being produced, those rooms stay cold. That is exactly what your feet are experiencing. A powerful habit you can build starting today is simple walking. Not just casual movement, but a purposeful walk where you're actively engaging your legs. Even 10 to 15 minutes a day is a good place to begin, and you can gradually increase from there. Now, the 11th and final sign. This is one of the most overlooked signals, and once you notice it, it can completely change how you look at your health. A reduction or complete loss of hair on your feet and lower legs. Most people never pay attention to this. It happens slowly over time, and because there is no pain, it goes unnoticed. But your hair follicles depend on a steady supply of oxygen and nutrients from your blood. When circulation becomes compromised, those follicles are no longer properly supported, and over time, they simply stop producing hair. I often explain it like this. Imagine a garden that is no longer being watered properly. The plants do not disappear overnight. They gradually stop growing. That absence of growth is a signal. In the same way, hair loss in your lower legs can be a visible sign that your blood vessels are not delivering what your body needs. This is not something to ignore. It is a quiet indicator, but it carries important information. Take a moment to look at your legs and the tops of your feet. Compare the hair distribution. If you notice significant thinning or absence in areas where it used to be present, it is worth getting your blood sugar checked. At this point, we have covered 11 different signs. Some are subtle, some are uncomfortable, and some are easy to miss entirely. But together they form a clear picture. Your body is always communicating with you. The question is whether you know how to listen. We have covered 11 different signs today. Some of them may have felt very familiar. Others may have surprised you. But what matters most is this. These signs are not random. They are your body trying to get your attention. And in my personal experience, after more than 20 years working with patients, I can tell you this. The biggest problem is not the condition itself. It is the delay. It is the time between when the body starts sending signals and when someone finally understands what those signals mean. I have seen people who could have taken action early, with simple daily habits, small adjustments, and regular checkups. But instead, they waited. Not because they did not care, but because no one ever explained these signs in a way they could recognize. That is why conversations like this matter. But I also want to be very clear about something. This video is not meant to diagnose, treat, or replace professional medical advice. Every body is different, and these signs can sometimes be linked to other conditions as well. This is information meant to help you become more aware, so you can ask better questions and take the right steps with your healthcare provider. So here is what I want you to do. Tonight, before you go to bed, take 30 seconds and look at your feet. Pay attention to the details. Notice anything unusual, even something small. Because catching a problem early can make a very real difference. If you recognize even one of these signs, do not ignore it. Take that next step. Talk to a medical professional. Get the clarity you need. And I would like to hear from you. If any of these signs felt familiar, go down to the comment section and type the word yes. Just yes. That helps this message reach more people who may need it. If you know someone in your life who should see this, share this video with them today. A family member, a friend, someone you care about. You might be helping them notice something they have been missing. And if you want more content like this, simple conversations that help you understand your body and take control of your health, make sure you subscribe and stay connected. Your health is something you can protect. Stay aware, stay proactive, and take care of your feet.